Welcome to CTV News Health and Environment Update. My name is Sister Juliana Abioye, EHJ. Nigeria receives monkeypox vaccines. Nigeria received 10,000 doses of monkeypox vaccines, becoming the first country in African region to receive doses to respond to the outbreak of the viral disease that has affected several countries and led to the declaration of a public health emergency of international concern by the World Health Organization.
I came to deliver a message about the mpox disease. I noticed that this disease has become viral in our community. I've asked displaced people like me to avoid shaking hands, avoid contact during greetings, and washing their hands regularly.
More than 500 cases of mpox have been reported in North Kivu. The Democratic Republic of the Congo has been hit hardest by the disease in Africa, with at least 548 people dying from mpox since the beginning of the year.
African health ministers kicked off the region's top health forum. African health ministers and government representatives gathered in Brazzaville, Republic of Congo, kicked off the 74th session of the World Health Organization Regional Committee for Africa, the continent's flagship health forum held annually to discuss and agree on measures to address health challenges and promote people's well-being. California legislature proposes ban on artificial food dyes. The Golden State became the first in the United States of America to pass a bill that, if signed into law, would forbid the use of the ingredients found in some popular cereals, ice creams, drinks, candy, ice pops, cheese-flavored chips, jellies, and more. The report is from the Environmental Working Group, a non-profit environmental health organization that co-sponsored the law with consumer. EFL embraces new helmet for players. The sound of football helmets colliding on the field is an audible sign that fall is just around the corner. Mounting scientific evidence shows that repeated hits to the head, even if they don't result in concussions, may cause lasting damage in the brain and perhaps progressive neurodegeneration called chronic traumatic encephalopathy, or CTE. Guardian caps have gotten a big boot from the NFL, which now allows all players to wear them during regular season games. The league also mandates them for most players during every preseason practice, as well as regular and postseason practices with contact. The caps maker, Guardian Sports, says its own extensive testing, as well as years of use by many large college football teams, prove that they reduce injuries on the field.
Protect the shield, protect the image of the NFL. At least that's what NFL Commissioner Roger Goodell is always saying. Helmet innovation, and then also lowering the amount of head injuries has really been the main focal point for years. That's why this announcement, even months before the NFL season, is so important. So
copious amounts of impact testing and simulation that are run up against the type of impacts we see in the NFL, the size of the players, the speed of the players, the environments they play in.
So these helmets, they're going to feel different. They're going to be lighter. They're also going to look a little bit different.
Parental stress is a significant public health issue, Surgeon General says in the advisory. U.S. Surgeon General Dr. Vivek Murthy has released an advisory declaring parental mental health an urgent public health issue. Murthy emphasizes that parenting is integral for the health of children and the health of society, but the stresses of parents are being passed onto their children. And now, Parents are experiencing new stressors on top of the already daunting task of protecting their children from harm. Managing finances and navigating the uncertainties teenagers face through adolescence. The adversary describes how mothers and fathers now work more hours than in 1985, but also spend many more hours every week on primary child care.
Do you attribute this difference in stress percentages between parents versus non-parents?
So I think it's multifactorial. I talked to my parents about this, and I have a 10-year-old, a 6-year-old, and a 6-year-old. And my mom says she feels bad for parents these days because there's social media that we have to deal with, right? Like back when I was a kid, I didn't have social media. There's sick leave, like there's familial leave. There's all of this keeping up with the Joneses where kids are in so many activities. Social media makes us all feel like all these other parents are doing so much. Why aren't we doing that?
Experts advise on need to wash fruits and vegetables. Eating fruits and vegetables every day is a great way to stay healthy. Just make sure you wash them properly first. While most people are aware of the danger raw meat and fish can pose to health, many consider fresh produce to be safe, but each year, 1 in 10 persons get ill by eating unsafe food, and about 46% of these cases of foodborne illness come from eating vegetables and fruits.
If you're eating fruits and vegetables raw, keep them separate from foods such as raw meat, poultry, or seafood, and the utensils used to prepare them. This will help avoid cross-contamination. Use separate cutting boards for meats and produce, as well as for raw and cooked foods. And finally, wash cutting boards, utensils, and countertops with hot water and soap between the time you prepare raw meats, seafood, and poultry, and any produce that will not be cooked.
Thank you for listening to Foreign and Local Health Update. I am Sister Juliana Abioye, EHJ.